Mary Immaculate Hospital's Patient's Guide to Total Joint Replacement. Hi, my name is Debbie, and I am your nurse navigator. I want to thank you for choosing Mary Immaculate Hospital to help restore you to a higher quality of living after your joint replacement. This presentation will outline the surgical process from getting ready for surgery through recovering at home, providing clear expectations regarding your orthopedic care. You play a key role in ensuring a successful recovery, and our goal is to involve you in your treatment through each step of the program. Your education and compliance will help to ensure a safe and successful surgical outcome. Please feel free to call me or email me if you have any questions or would like to discuss any information presented. Pre-Operative Education Book. All the information presented in this seminar can also be found in the Get Ready for Total Knee Replacement book, Get Ready for Total Hip Replacement book. You should have gotten a copy of this book from your surgeon's office when you scheduled surgery. If you did not get a copy of the book, you can click the link right below this seminar and download a copy of the book. Feel free to follow along in the book as we go through the seminar. But there's more information in the book than presented in this seminar, so make sure you read the book. Fill out the survey. When you have completed this seminar, please fill out the survey located on the preoperative education page above this seminar. Once you fill out the survey, a copy of the survey will be emailed to me so that I can let your surgeon know you watched the seminar. If you have any questions, please ask them in the survey. I will send you an email or call you if you don't have email to answer these questions. About your surgery. You will find general information about your hip or knee replacement in the pre-op surgical book. Please speak with your surgeon for more detailed information about your specific surgery. Did you know the recovery from a hip or knee replacement is all muscle recovery? Before surgery, the arthritis in your hip or knee caused you quite a bit of pain, so you learn to walk differently and use your leg muscles differently to help ease the pain as best as possible. After surgery, you will no longer have arthritis in your hip or knee. You'll have a brand new prosthetic. However, the leg muscles will be stiff and tight and sore and weak, so your recovery is muscle retraining. One way to help ease your recovery after surgery is to begin doing the exercises in the back of the preoperative book today. The stronger your leg muscles are, the easier recovery will be after surgery. Pre-anesthesia testing. Once you and your orthopedic surgeon have agreed that surgery is the best option for you, your surgeon's office will send information to our pre-anesthesia testing department regarding your surgical procedure. From here, you will be scheduled for a preoperative nursing interview. You will receive a phone call from our pre-anesthesia testing staff before your surgery to schedule your nursing interview. During this important scheduled time with the PAT nurse, you will be asked to share your medication history, surgical history, allergies to both foods and medication, and a list of your daily medications, including vitamins, herbal supplements, anything over the counter that you take orally or apply topically. Be sure to have the bottles available for this interview so that you can provide the medication name, dosage, and frequency. Your personal medical history will determine what preoperative testing you will need before surgery. While your nursing interview must be scheduled, your medical tests may be completed without an appointment within 30 days of surgery. Common tests include lab work, which is non-fasting, meaning you can eat prior to the lab draw, an EKG, a chest x-ray, and a urinalysis. These results will be sent to your surgeon, and you will be contacted if the test results are abnormal. It is also best to undergo a complete physical examination with your family physician within 30 days of surgery. Your surgeon will let you know if this is a requirement to have surgery. If you have any high-risk medical conditions or see a specialty doctor, you may also be required to obtain surgical clearance from these physicians. Medications. During your PAT interview, a nurse will tell you what medications to stop, when to stop them, and what medications to keep taking. Please make sure you have a piece of paper and a pencil or pen available so you can write down the instructions you're given by the nurse, as it's easy to forget as you wait for surgery. Herbal supplements. Stop all herbal supplements and vitamins 14 days before surgery. Non-steroidal anti-inflammatories, also known as NSAIDs. Stop them 10 days before surgery. For a list of non-steroidal anti-inflammatories, please look in your preoperative book. Anticoagulants, also known as blood thinners, and diabetic medication. Please speak with your surgeon and prescribing physician about what to do with these medications. You will need to stop your blood thinners at some point as you wait for surgery, so make sure you know when to do that. Daily medications. Again, the PAT nurse will go over this information with you during your phone interview, so make sure you write down the medications you're to keep taking and the ones you're to stop and when they need to be stopped. Pain medications. You can keep taking the following pain medications as you wait for surgery. Tylenol, also known as acetaminophen, oxycodone, Percocet, hydrocodone, Vicodin, Norco, Tramadol. If you have any questions, please call our PAT nursing department at 757-886-6411. COVID testing. Mary Immaculate Hospital's COVID testing policy is constantly changing based on the CDC guidelines. Contact your surgeon's office or our Pre-Anesthesia Testing department at 757-886-6411 if you have any questions or need clarification. Getting ready for surgery. Start by picking a coach. A coach is a friend or a family member, but should be someone that's available to help you the first few days after you return home from surgery. If you go home the day of surgery, you will need to have arrangements for someone to stay with you the first 24 hours after surgery. Stop smoking. Smoking increases your risk of lung complications during and after surgery. It also decreases the ability for your body to heal itself. If you aren't ready to stop smoking yet, try to cut back 2 weeks prior to surgery, and do not smoke the night before or the morning of surgery. Stop alcohol intake, or at a minimum, limit your alcohol intake at least 2 weeks before surgery. After surgery, please check with your surgeon before you resume drinking any alcohol. If you're taking any medications with Tylenol or you're still on narcotics, do not drink alcohol. Eating healthy. Eating healthy is an important part of healing after surgery. Maintaining a healthy diet decreases the risk of heart disease, high blood pressure, diabetes, and it gives you energy as you recover. Prepare and freeze or purchase small portioned healthy meals for times you may be alone. Keep moving and do the pre-op exercises. You can find the pre-op exercises located in the back of your pre-op book. Do those exercises to the point where you can't tolerate the pain. The stronger your leg muscles are and the more stretched out they are, the better your recovery will be after surgery. Set up your home. Make sure that you pick up any tripping hazards such as throw rugs, as you'll be on a front-wheeled walker. Put night lights in dark areas. Rearrange your furniture so you can safely get your walker through. Make sure you make arrangements for pets, as they can be tripping hazards after you're recovering from surgery. Get these things before surgery. Make sure you have some Tylenol/acetaminophen extra strength, which is 500 milligrams, at home so you can take this scheduled if you're not on a narcotic with Tylenol, or you can take the Tylenol in place of your narcotic. You want to have a stool softener, and make sure you've purchased and have your front-wheeled walker to bring with you to the hospital, as Mary Immaculate does not provide those. Cleaning your skin 3 nights before surgery. You should get your CHG bathing solution from our registration department when you come for your preoperative testing. If you did not get the CHG bathing solution, you can either come by registration and ask them for the cleaning solution, or call our pre-anesthesia testing department at 757-886-6411 to find out where you can get the solution. It's important that you do bathe for 3 nights, as it decreases the risk of infection after surgery. Countdown to surgery. Please refer to your preoperative education book, where you'll find a detailed list of the things you should be doing as you get ready for surgery. However, I'd like to highlight a few things to make sure that you get these things done. 4 weeks prior to surgery, schedule your preoperative physical. Plan to have your preoperative testing done. And also, if your surgeon or primary care doctor have asked you to get clearance from a specialty doctor, make sure you have those appointments set and you keep those appointments. 10 to 14 days prior to surgery, stop taking any medications your primary care doctor, your surgeon, or our pre-anesthesia testing nursing staff instructed you to stop. Definitely pay attention to any blood thinners that you take and make sure you know when to stop those. Stop or cut back on alcohol intake and smoking. It's important you set up your bathroom and get your front-wheeled walker before you come for surgery. Mary Immaculate does not provide walkers when you come. 3 nights before surgery, make sure you start your skin preparation. Please refer to your preoperative book, where you'll find detailed step-by-step instructions on how to do this. The day before surgery, please make sure you're drinking plenty of fluids, and before you go to sleep, make sure you eat a snack. Remember, there's nothing to eat or drink after midnight. The morning of surgery, do not eat or drink anything, but you can take a sip of water to take any medications you were instructed to take the morning of surgery. You also are safe to brush your teeth. Going home after joint replacement. Your surgeon may be planning to send you home on the day of surgery. If you're not sure, please ask your surgeon if you'll be going home the day of surgery or staying 1 night. Things to bring with you to the hospital the day of surgery include your front-wheeled walker, a CPAP machine if you use it, and please bring your glasses or denture case. Where and when to come the day of surgery. Your surgeon's office will call you the day before surgery and let you know what time you need to be at Mary Immaculate Hospital and what entrance you need to take in order to come to the pre-op area. When you arrive and you get checked in, you'll be taken back to the pre-op area where you'll be wiping off with CHG wipes, and your nose will be swabbed with an antiseptic. You'll have a warming blanket applied. These are all to help prevent infection after surgery. We'll check your vital signs, review your medical history, your surgical history, and medications again, but do not bring your medications with you to the hospital the morning of surgery. The nursing staff will put an IV in. You'll meet with your surgeon and anesthesia team, and any medications your surgeon or anesthesia order for you will be given to you, to include antibiotics and fluids for hydration. Anesthesia information. Your anesthesia team consists of an anesthesiologist and a nurse anesthetist who are responsible for your comfort and well-being before, during, and immediately after your surgery. They will meet with you in the pre-op area to help develop an anesthetic plan based on your health history, medications, and personal needs. Decisions regarding the type of anesthesia you will receive are made with your anesthesia team. The types of anesthesia available are general anesthesia. With this type of anesthesia, you will be unconscious throughout your procedure. A combination of anesthetic gases and medications will be used to ensure you are comfortable and asleep during your surgery. Regional anesthesia. This technique involves the injection of a local anesthetic to provide loss of sensation. If you choose a spinal block versus general anesthesia, an injection will be administered into your lower back, numbing the lower half of your body. You will still be given medication through your IV to make sure you're asleep and unaware of the surgery. One note about spinal anesthesia. You want to know that your legs will feel heavy or numb to you when you wake up, but that will wear off quickly. The first thing that wakes up with spinal anesthesia is your bladder, and you may have a little bit of leaking, which is expected. Adductor canal nerve block. A nerve block is an injection of a local anesthetic into or near a nerve for temporary control of pain. This nerve block is offered only to total knee replacements due to the area of the leg it affects. It is a single injection performed before surgery and is used in addition to general or spinal anesthesia to provide you with pain relief for 6 to 12 hours after the injection. This is a sensory block. Therefore, you will be able to move your leg and get up and walk after surgery. Exparel. This is a medication that is injected into the tissue around the joint during surgery to also help provide pain control for 12 to 24 hours after surgery. Post-anesthesia care unit. Once your surgery is over and you start to wake up, you will be taken to the PACU, also called the recovery room, where you will continue under the care of your anesthesiologist. Your vital signs will be observed closely as the effects of anesthesia begin to wear off. Early on, you may feel dizzy, sleepy, or confused. It is not unusual to be groggy for the remainder of the day. After you have been deemed stable by your anesthesiologist, you will be moved from the PACU to a room where you will recover under the care of your surgeon and our nursing staff. If you are going home the day of surgery, you will be taken to Phase 2 discharge unit. You need to have someone stay with you the first 24 hours at home because of the anesthesia in your system. If you're spending the night, you will be moved to an inpatient hospital room, and your family will be told where you are. What to expect after you wake up from surgery. Pain management. Pain is a normal part of recovering from a joint replacement. Please set realistic expectations. Know that you will have pain, but your care team will work with you to see that you have pain tolerance. Pain tolerance means that you will have pain, but you will be able to get up and walk and do the things you need to do to recover at home. You may be sent home with a non-narcotic prescription such as an NSAID. You also may be asked to take scheduled Tylenol, and you'll have a narcotic. However, you also want to use ice, elevation, distracting your brain from thinking about the pain, getting up and moving short distances every hour you're awake, and doing the exercises that therapy prescribes for you. Do not sit around after surgery. You want to keep those muscles moving, warm, and loose. You may wake up with sequential compression devices on your feet or calves in order to help with preventing blood clots. These are machines that will squeeze air to your foot or your calf to help promote circulation as you wake up from surgery. You may wake up with white support hose on or have them put on before you go home. You want to make sure you wear those every day except for when you're bathing off, and you may take them off at night, wash them, hang them up to dry, and put them back on the next day. Make sure that you wear them until you go back to your first post-op checkup with your surgeon, and they will let you know when you can stop wearing them. Incentive spirometer. That is a machine that you'll get that encourages you to take deep breaths to help prevent pneumonia and fever after surgery. You want to take deep breaths every hour, 10 times an hour. And you want to get up and walk short distances every hour. You will see an occupational and a physical therapist before you go home. They will work with you on bathing, dressing, getting up and walking, taking the stairs, and show you what exercises you should do until your home health therapist comes out to see you. Ice and elevation. Ice and elevation are two critical pieces for your recovery. Swelling will cause you a lot of pain and stiffness and soreness. Using lots of ice on your leg, anywhere your muscles hurt, will help to decrease the swelling that helps with pain control. Elevation. You want to elevate your leg where your toes are higher than your heart level. For total hip replacement patients, you want to elevate your leg a couple times a day after you walk and exercise. For total knee replacement patients, you need to elevate your leg whenever you're not up walking or doing your exercises. The more you elevate, the better the pain will be. Now, with total knee replacement patients, when you elevate your leg, you want to make sure that your knee is straight as you elevate your leg, because you're working on getting the muscles behind your leg stretched out and straight. Medication review. You will be required to take several different kinds of medications after surgery. So let's review. Pain medication. That can be prescription narcotic, non-narcotic prescription, or over-the-counter. Your surgeon may prescribe an NSAID for you to take. Please follow the bottle and take as prescribed. Do not take any other over-the-counter NSAIDs while you're taking a prescription NSAID. Know that NSAIDs thin your blood and they cause bruising. You may be asked to take scheduled Tylenol around the clock if your narcotic does not contain Tylenol. Please refer to the book where you'll find a page on how to safely take Tylenol. Narcotic pain medication. Know that you are to take the narcotic pain medication as you need it to help you achieve pain tolerance. If the narcotic is not working after surgery, or if you're about to run out, please call your surgeon's office. Stool softener. Constipation is a side effect of anesthesia and narcotics. Therefore, at home you need to take a stool softener while you're taking a narcotic. If your bowels do not move within 2 days of surgery, you may need to take a laxative, and also drink plenty of fluids. Anticoagulant, also called a blood thinner, that causes bruising. This is to help prevent blood clots. Please follow your surgeon's instructions on how often and how long to take this medication. Do not stop it on your own. Home medication. Your care team will let you know which medications you can resume when you get home and which medications you may need to still hold. Please look at your discharge paperwork for information about that, and if you are not clear, please call your surgeon's office to get clarification. Outpatient pharmacy. You will be provided with the opportunity to fill your medications at our outpatient pharmacy located in the medical pavilion, or you can have your prescriptions filled at your normal pharmacy. When you come for surgery the morning of surgery, make sure you let your care team and your surgeon know if you would like to have your prescriptions sent to your own pharmacy or filled here. Preventable complications after surgery. Blood clots. The best way to prevent a blood clot is to get up and walk short distances every hour, move around when you're sitting or lying in bed, do your ankle pumps or foot rotations, and make sure you take your anticoagulant, blood thinner medication as prescribed by your surgeon. Constipation. Constipation is a part of surgical recovery, especially from anesthesia and narcotics. Please make sure the minute you get home you take a stool softener, and if your bowels have not moved within 2 days of surgery, you take a laxative. Also make sure to get up and walk and drink plenty of water. Pneumonia. The best way to prevent pneumonia is to take deep breaths and to get up and walk short distances every hour. You can also use your incentive spirometer that you'll be provided with at the hospital to help you take deep breaths. Infection. The best way to prevent an infection is to make sure you keep your incision clean and dry, that you only shower as directed, but most importantly, make sure you're washing your hands. For warning signs about blood clots or how to identify an infection, please refer to pages 26 and 27 in your book. Home health care. Our goal is for you to recover at home. continuing your physical therapy and any related care you need in a more familiar surrounding. Home health services may include a physical therapist and a nurse. If your surgeon is planning for you to go home the day of surgery, your surgeon's office will have made these arrangements before surgery. If your surgeon is planning for you to spend one night, our care manager will visit with you to make sure your home health is arranged. Tylenol, also known as acetaminophen for pain. As you wait for surgery, remember you're going to be asked to stop any NSAIDs you take. We know that NSAIDs help with arthritis pain. Many people want to know what they can take as they wait for surgery when they can't take their NSAID. You can safely take Tylenol or acetaminophen for pain control as you wait for surgery. We know that it doesn't help arthritis pain, but it can help some, and it can alleviate some muscle soreness and aching. Please refer to your pre-op book where you'll find a page on how to safely take Tylenol. But you can take 1 extra strength Tylenol every 4 hours or 2 every 8 hours. If you have Tylenol arthritis, you can take 1 every 6 hours. Please check if you're taking a narcotic to make sure that it does not contain Tylenol or acetaminophen in it, as you do not want to take more than 4,000 milligrams of Tylenol in a 24-hour period. Also, if you've been instructed by any doctor to stop any Tylenol intake or you're allergic to it, then please do not take it. Knee or hip recovery book. Make sure you go home with a recovery book from Mary Immaculate Hospital. This book will remind you of all the things you need to do to have a successful recovery at home. Also read your discharge paperwork where your surgeon will have specific instructions for you to follow once you're at home. Thank you for trusting Mary Immaculate Hospital for your total hip or knee replacement surgery. We look forward to meeting you and helping you on your road to recovery. After you close out this seminar, please don't forget to go back to the top of the page and complete the survey. Please ask questions if you have any or ask for clarification about information. Make sure you provide me with a working email address and your phone number on the survey so I can reach out to you and answer any questions you may have. Thank you.